Welcome, everyone. My name is Dan Jeline. You're attending now one of the latest CSCRS research to practice bites webinars, where we're going to talk today about case studies of examples of how systems thinking has been used to inform safe system partnership, strategic planning, and research around the U.S. So I'm delighted to introduce our panelists today, Dr. Becky Naumann, who's an assistant professor in the Department of Epidemiology at the UNC School of Public Health and core faculty at UNC's Injury Prevention Research Center. So we'll be hearing from Becky in just a moment. I wanted to share just a bit of information with you about CSCRS if you're not familiar. Our goal is to accelerate progress in reducing transport injuries and fatalities from a planning, engineering, and public health, data science, and robotics perspectives, and bringing all of that expertise to the road safety field. We are one of two national centers with a designated research focus on transportation safety. We bring together faculty, staff, and students from different UNC departments, as well as our partner institutions that you see here on this slide. Couple new resources I'd like you to take a look at when you have time, and you can visit roadsafety.unc.edu to find out more about each of these. But there's a report on a vision for safer road system that'll provide a deep dive into some of the work that we've been doing in this area. There's also a video accompanying that if you'd like to kind of take a look at that, a really nice multimedia presentation of what we've been working on, and then a 2-page executive summary with the highlights of that work, all resources that you might be interested in if you're interested in hearing more about the work that we've been doing as part of CSCRS. Just some housekeeping before we move on. Participants, you will be muted during the webinar, but you do have the ability to submit questions via the Q&A option. The session is being recorded, and we'll be posting that on the CSCRS website. We'll also be providing some additional information, some slides, things like that after the webinar is over. And just a tip, you might want to use the speaker view option so you can see both our speaker and the slides being presented during the presentation today. So without further delay, I'm going to go ahead and ask Becky Naumann to share her slides, and we'll get right into it. Becky, whenever you are ready to do that.
Great, thank you. All right, pull these up. Okay, and can you see them, Dan?
Yep, you're all set.
Great. All right, well, thanks for having me today. Thanks, Dan, for that introduction. So as Dan already mentioned, I am excited to talk to you guys today about some work that we're wrapping up right now, really focused on trying out some systems thinking tools, again, to help advance kind of partnership, strategic planning, and research that really embodies kind of a safe system approach and safe system principles. So really focused on things like breaking down silos and carefully considering the larger systems at play that are driving our transportation problems and how to more effectively kind of intervene in those systems. So kind of in terms of a quick game plan, we only have about 20-25 minutes, and I want to save time for discussion. I'm going to spend just a couple of minutes hopefully demonstrating, maybe hopefully convincing you of why I think a safe system approach and systems thinking kind of go so well together, why they are kind of a perfect match. I'll then talk specifically about the objectives of this work and what we were trying to achieve, which was really, again, trying out some of these systems tools with a variety of different stakeholders, coalitions, task forces, gathering some feedback, and then really kind of compiling them into concrete how-to guides, concrete case studies, so you could see, okay, here's a tool I might want to use, and here's kind of what it would get me and what it would look like. We're then going to talk about, again, this kind of wider range of case studies and tools that we actually kind of used. It was a subset of a much larger systems thinking toolbox, so I'll tell you kind of the ones we focused on. And then we can't talk about all the case studies, but I will talk a little bit more about a couple of them, do kind of a couple deeper dives into 2 of the groups that we worked with. Okay, so I hope I know my audience well enough here to know that I'm not going to go in detail on the safe systems approach. I'm assuming that most everyone on the call is familiar with at least kind of the general ideas and core principles and kind of what we're trying to achieve with the safe system approach. But what I do want to highlight here, and quite kind of literally highlight here, is this core focus within the safe system approach on coordinated action and shared responsibility, right? And we often see this, and we're seeing this really operationalized through cross-sector task forces and coalitions. ideally designed to better coordinate our transportation kind of strategies, maybe re-envision some of our transportation strategies. And this is really believed to be a critical piece and component of a safe system approach. I'd also say this kind of goes hand in hand with a need that we hear a lot, and rightfully so, about really helping us and thinking through how to develop and support a traffic safety culture that's consistent with these safe system goals. And so there's a lot of discussion right now, again, and rightfully so, about transforming and cultivating a positive transportation safety culture that's consistent with a safe systems approach and consistent with safe system goals. And so I'd argue that to get to this kind of shared responsibility piece, right, we know there's a lot of work we probably need to do within organizations, within agencies, between organizations and agencies, to really develop a shared understanding of what the system we're operating in is, and to own the shared responsibility and the pieces within the system that we really need to be kind of intervening, hopefully, again, better on, and how our different pieces of work kind of fit together a little better. So this is the part where I argue that I think systems thinking can kind of help us get there, right? And so all this is, and this is just kind of a quick definition of systems thinking, all it is, it's a lot of different tools, but they are tools or frameworks that help us conduct practical structured inquiry to see the bigger picture, right? To see the whole, and they support development and or testing of a model, and that could be a qualitative model like a map, or it could be a quantitative model like a simulation model, that lays out and represents the different pieces of the system and how they're kind of working or fitting together to drive an outcome. So anyways, it's kind of a mouthful, but the idea here is it's a set of framework and a set of tools to help us see the bigger picture. The idea being, if we can step back and see some of these systems, kind of appreciate and see some of the complexity in these systems, it might help us think more strategically about how to intervene and how to work together and how to, again, share that responsibility and promote coordinated action. Okay. I won't spend a lot of time on this, but so this just says, okay, if we're going to do all these things related to safe system work on the left, right? If we're going to coordinate actions, center safety, manage energy transfer, adapt to human behavior, systems thinking can help us kind of get there, help us strategically think through this complexity and these different pieces, providing structured tools to engage the diverse stakeholders that we need to do this work, et cetera. All right. So that was my quick spiel on kind of safe system and systems thinking, and hopefully why systems thinking might be able to help or be an additional piece of our kind of toolbox in implementing a safe system approach. So in terms of what I mentioned earlier, in terms of what we were really trying to do in this project was to develop some tangible, concrete products on what these tools actually look like and how they can actually help, and give some really concrete examples of using them with transportation partners. So there's a whole bunch of tools that we could have picked from, and this is not even an exhaustive list. These are a lot of the systems thinking tools that we tend to use at UNC when we're working with partners. As you can see here, I have them grouped into qualitative tools and quantitative tools. For this project, we were focused more on these qualitative tools, again, things that you could use in strategic planning meetings, task force meetings, coalition meetings, etc. And I'll talk about, these were the 5 we focused on, and I'll talk a little bit in more detail about what these kind of get you and what they do. But I do want to mention that in other CSCRS supported projects, we've utilized some of these other tools, some other qualitative and some other quantitative, to explore systems and quantitatively kind of estimate different phenomena. And so if you're interested, we can certainly direct you to those resources or talk more about those. All right, so this is a laundry list, and I won't go through these all for the sake of time, but these are the different kind of case studies and the different groups we work with to pilot some of these tools as part of this work. So again, what we have here is what the group was essentially trying to achieve and why we thought a systems tool might help them. And then under it, you'll see the specific tool that we essentially kind of matched with them. So prior to any of this work, we had a lot of conversations with these groups on, okay, are there any sticking points or current challenges you're really facing? Listening for opportunities where we thought a systems tool might help, right? It's not going to help in every situation. And to really help them think through if there were points for which these could help them get unstuck or accelerate their safe systems work. And so, for example, We worked with King County in Washington, their Target Zero task force, and they were really at a point where they wanted to kind of restart some of their safe system and Target Zero work at the county level. And we know Washington's doing a lot of amazing things in the safe system space at the state level, at different kind of municipality levels. And the county was at a point where they wanted to kind of re-envision their efforts. They wanted to take stock of the different players within their system at the county level, what assets they could bring to a safe systems approach, and kind of how they fit in to what was happening again at sort of like the state level and at municipal levels. And so we used a tool called goal and action alignment mapping, which essentially maps out the different stakeholders that you have in your system, right, at this level, and really helps you strategically think through what they can contribute to an initiative, and also simultaneously, hopefully, helps kind of convince them why they should be invested and involved in that initiative, like a safe system initiative, by explicitly demonstrating to them the benefits of their involvement. It also helps you begin to kind of match up different partners within the system and see where there might be potential win-wins for those partners, where they could kind of help each other, right? Scratch each other's back. So we'll talk a little bit about that one, specifically within the context of the second case study, which was some work that we did with the North Carolina Safe Routes to School leadership, where we invited safe routes to school leaders from across the country, or across the state rather, to also use this tool to really help re-envision the systems within which their safe routes to school initiatives were operating, and to help strategically think about the different partners and players and how they could kind of expand their work and touch different parts of the system a little bit better. So I'll show you that one in more detail in a minute. Another case study or group we worked with was Safe Trek and CalWalk. Some of you may be familiar with them out in California. They have a really successful and fruitful kind of history of collaboration and partnership together. And they wanted to do some strategic thinking about, again, how their work was situated within the current system of transportation safety in their area and where they should really be going next. Kind of do a reset and say, okay, are we really having the biggest kind of system-wide impact that we can have? And if not, how do we need to kind of reshape this partnership, engage other partners that are touching different pieces of the system to have a bigger impact? And we used a couple of different tools with them, a system support mapping and a tool we call Balance of Petals that helps us do some of that work. And the last one I'll mention, and then I want to get into some more specific case studies, is work that we do a lot of work with North Carolina Vision Zero coalitions. We have about 15 coalitions right now across the state. And one of the tools we really like is called the 5 Rs. And we've talked about it on some other kind of webinars and can certainly send out some more specific resources about it. But essentially what we were doing with Vision Zero coalitions is we hear a lot of discussion that, okay, safe systems approaches, Vision Zero approaches really need to center equity. And yes, and also what does that tangibly kind of look like in our day-to-day? And so the 5 Rs approach is a tool we were using with them that helps you explicitly and critically examine different domains of the system, right? Resources, rules, roles, relationships, these different specific pieces of the system. In this case, we're using it to understand the structure of inequities in the system and inform kind of tangible steps. So not just kind of talking broadly about inequities, but to really critically examine pieces of the system that are perpetuating inequities. Okay, so let me stop there. I could go on and on about these, but what I want to do is I want to hone in on these 2 specific ones and show you some diagrams and kind of give you a little bit more sense of what we were doing. Okay, so the first case study, again, was with the North Carolina Safe Routes to School program. I mentioned this earlier, a group of leaders, they were coming together towards the beginning of the school year. They brought current partners involved in their Safe Routes to School initiatives, and these were different Safe Routes to School kind of groups and initiatives across the state. And they also invited potential partners, people that they were kind of wanting to engage with a little bit more, or thought, hey, I think this work kind of touches at least tangentially what they're doing. How can we kind of engage them? And so we used a tool called Goal and Action Alignment Mapping. And as I mentioned, this is a tool that allows different partners to see how they're embedded within a larger system that includes shared goals and eliminates kind of different win-wins for partners, right? To help motivate why they would want to be engaged in a bigger system-wide effort. So essentially what you do is you first work with a group of stakeholders or partners to really get clear about what their shared understanding of success is, right? So what outcomes or results do they really, really care about? What's their shared view of a good result? You then have each person, generally representing a different kind of organization or agency in the system, kind of put those to the side, but lay out and tell the group and write down what are their three main objectives that their agency is or organization is trying to achieve. Like, what do they really care about on a day-to-day basis, irrespective of what Safe Routes to School is trying to achieve? What does their organization really care about? Then you have them lay out what are the primary challenges their organization is facing, right? What are their pain points? What are they kind of struggling through? And then what you're doing is you're bringing back those Safe Routes to School core results and objectives, and you're trying to help them articulate or think about any connections between what their organization is trying to achieve or what their pain points are and what Safe Routes to School is trying to achieve. And you're looking for connections in two different ways. You're looking for how Safe Routes to School outcomes, if we get there together, if we achieve those, how they would feed back to help the individual organization goals and challenges, alleviate some of those pain points. So again, how is being involved in this and getting us to those outcomes going to help my individual organization? And then what are some things my individual organization might already be doing that I could say, we're already doing some work in this space and it actually could feed back and support what Safe Routes to School is trying to achieve here. And maybe it's just letting them know about a resource we have. Maybe it's tweaking something we're doing a little bit more to help support Safe Routes to School activities, etc. So this is what it looks like. Again, each partner is developing their own kind of map frame set of sticky notes. These are some of the results or some of the outcomes that we had laid out for what a lot of Safe Routes to School initiatives are trying to achieve. So things like increasing transportation and mobility safety for children, increasing physical and mental health for children and their families, increasing community connectedness and livability. And then this is an example of what a partner then said, okay, let me just tell you for a second about what my organization is trying to achieve. And this was a public health partner that was engaged in Safe Routes to School work. And they said on a day-to-day basis, irrespective of what Safe Routes to School is doing, I'm trying to increase population health by promoting better access to medical care, by increasing community connectedness and coordination and collaboration, and that really helping promote access to social services or services that address social determinants of health, like food insecurity, et cetera. And then they said, let me also tell you about my pain points, what we are up against right now. There's a lot of competing health priorities, limited resources, we're having a hard time building and maintaining community relationships, and we're having a hard time kind of gaining trust in the community. And then what they essentially started to tell is make connections between what Safe Routes to School is doing and what they're trying to achieve, or what their resources that they might have available that they could kind of provide to Safe Routes to School. And what I don't have here, unfortunately, could not copy over well, is on each of these arrows, they're telling us a little story, right? They're essentially writing out and explaining that connection in the sidelines. I do have some examples here. So these are just some screenshots from, again, these individual maps from different people. And so these are some examples of what people were writing out when they were talking about how helping Safe Routes to School achieve its goal would feed back to their specific organizational goals. And so we heard things like, if we can do a better job of improving, environments around schools and promoting Safe Routes to School works, it could actually help my organization achieve its goals of increasing connectivity for different modes, expanding our multimodal network. So that was like a local DOT that was really focused on that. It could help expand services to medical care in the surrounding kind of right near the school. So that was what another partner said, is they were at the hospital and they were like, how do we expand services to what we're doing? And they're like, oh, maybe we should partner with Safe Routes to School. And if we can kind of help expand what they're doing under their initiative, this is actually going to directly help us as well. So it was really trying to identify those win-wins. And then in terms of, these are some examples of what organizations were then saying, hey, this is what we can give back to the initiative, and this is where we can kind of touch the system. We heard things like, hey, we just developed a new pedestrian plan. There are several school sites near the top, and let's collaborate that and really strategically think about how this can support Safe Routes to School initiative. Or someone said, I'm an advocate and I'd love to talk to you about your advocacy agenda and how I can support Safe Routes to School goals through some of the advocacy work that I'm already doing. So those are some examples. It's right, helping to think about different parts of the system, how to expand our networks and touch on these different pieces. I'll just quickly mention, we then have you're then essentially kind of synthesizing and looking across these different individual kind of maps or frames and connections. And then we have some very specific questions that we guide people through to develop kind of next steps for action. This just notes for all of these case studies, we did do at least kind of pre and post data collection on how people's thinking changed related to the issues that they were dealing with. And here the blue is pre and orange is post. And so this is showing a little bit of change in how people are really seeing relationships in the system and connections in this work and identifying tangible action opportunities they hadn't originally thought of. And again, how that kind of changed over time. Okay, second quick case study. I'm going to try to do this in 5 minutes. So we have about 5 minutes for question. This was work that it was a little different. So this was work that UNC was already engaged in with Philadelphia's Vision Zero program. And they were doing a deep dive, really looking at child and youth pedestrian injuries on their streets. And then, so they had done sort of a lot of quantitative data analysis and hotspot and really trying to understand the problem. But they wanted to use systems tools to better think about what was happening in their communities, consider next steps for planning and action, and to really kind of lay out what they might not be able to see in the data, which is a benefit of some of these tools. And so they acknowledge that, hey, we have a lot of data, we've done a lot of quantitative analysis, it's taken us as far as we can. We know there's a lot of stuff we can't see in the data. So let's bring together a diverse range of stakeholders, including some of our different kind of Vision Zero related stakeholders, to really start to talk about what other pieces are important here and help us think strategically about where we want to go in terms of action and intervention. We used a tool called causal loop diagramming, which is essentially a structured way to lay out how different factors in the system may be connected and working together to drive a problem. So in this case, we were helping to kind of build capacity with this type of systems mapping notation. Again, bringing different perspectives together that might have a different understanding of different pieces of the system based on their backgrounds, to really try to piece together what's going on in terms of increasing trends in child and youth pedestrian injury, and again, where in the system we might most effectively intervene. So we did 2 meetings with this group and they were pretty quick. So we don't always do this, but for this one, we developed a seed diagram or an initial diagram based on the quantitative data analysis they had already done, and starting to piece together kind of what we knew from their data analyses and what we knew from other pedestrian maps that our group had done with a variety of other stakeholders as a initial point for them to, potentially rip up, add to, say, hey, I don't think this is right for Philadelphia, but something to get us kind of going. And then what we did with them is we reviewed, edited, and collaboratively kind of built up the map, kind of capturing, again, key perspectives and stories that they were seeing. And so what you have here is these pink pieces are really a lot of what was added kind of during these workshops. And again, hopefully what you see here is a lot of what our data can't always tell us, our quantitative data, right? So there was a lot of discussion about community buy-in for projects, distrust, fears of gentrification, a lot on kind of culture and how that feeds into funding decisions and what projects do and don't get kind of prioritized. Some discussion about kind of perceived neighborhood safety and other kind of competing priorities for community members, et cetera. And so what we did is we built up this map, and then we had the different stakeholders, we had a lot of agency kind of leaders think about, okay, where is what you're currently doing? What parts of this is your work touching? If it's not going well, can we start to see in the systems map why it might not be going well, right? If there's things undercutting it. And how can we think more strategically about kind of future action together? And we kept a running list of potential actions that people were kind of bringing up throughout. And then what we essentially did is we ranked and prioritized those, and kind of they voted on those. And so what ended up coming out at the end of the meeting, which was reflected in the discussions, I think, throughout these workshops, was a real focus on channeling resources to low income and marginalized communities, a real understanding of needing to do more outreach with communities to kind of co-create change. Again, a lot of discussion about rebuilding a lot of community trust. So what we did is we then kind of put this in a hopefully kind of somewhat visually appealing map on the core conversations that had happened, as well as some of the quotes and stories that we heard, and kind of where they landed about what was really important for their work moving forward and what they really wanted to prioritize as a group. And we can send these around. At the bottom here is a public facing kind of systems map that will walk you through, again, some of these discussions and kind of where they landed. Okay, I meant to leave a little bit more time. I'm going to stop here. But in summary, right, hopefully I was able to demonstrate how some of these systems tools I think can really help kind of reimagine and restructure conversations that are consistent with a safe system approach, thinking kind of developing that shared understanding, thinking about who we need to be bringing into these efforts. I use them a lot from a research perspective. I didn't touch on that a ton, but hopefully you could see how those maps could really help inform your research questions and what we do and don't know and kind of need more information on. Just a couple of acknowledgements. There's a much bigger team that was a part of this, and lots of thanks to the coalitions and task forces and groups that let us kind of step into their work for a bit. And that is it. I will turn it over for questions. We don't have a lot of time.
Great. No, thank you for that. And questions, please do send those in if you have them. So one of the first ones I was curious about that came in, Becky, is when you begin working with or say an organization is like, I want to move forward with doing something like this, assume it's super valuable. Do you find that it's more valuable for a group, say maybe a unit within like a DOT, who it's a small group that's all doing the same kind of work and they're really interested in doing this themselves? Is that more valuable than, say, that group getting with a broader coalition of folks from all over the city, possibly, or the region or the state, and really going through this with a more diverse group of partners? It seems like a lot of the groups you worked with through this were coalitions or task forces that brought together already a lot of different perspectives, not necessarily like this one unit of a DOT who's kind of got a laser focus on this part of the system. Could you maybe speak about whether it's more ripe for doing this with a certain type of group, narrower or broader in focus?
Yeah, I mean, I think you could do it with either, right? You have to recognize that you're going to get very different things depending on who you include. And I think it all comes back to what your goals are. I mean, groups have used this within internal units of, let's say, a DOT or a Department of Public Health, or whoever, even research groups. And we've used these within our individual research groups to help strategically think about, okay, what questions have we answered? Where do we feel like we know? Where does it strategically make sense for our research to be going next? That sort of thing. So I think you can do it with either. I think that some of these tools, particularly the 5Rs, I know I didn't spend a lot of time talking on it. It's essentially a framework of 5 questions, and it is very easy to pick up. Again, we'll have kind of how-to guides on these released very soon, and everyone, I'll make sure everyone on this call gets kind of those email blasts. Very easy to pick up and can be done within an hour of a team meeting. Some, like the causal loop diagramming, takes a bit more time, a series of workshops. Generally for those, I will say you do want a more diverse range of people, because generally speaking, the goal is to better understand the different pieces of the system, recognizing that we only have knowledge and understanding of what we know about, right? Of what our training and expertise has led us to.
That makes sense. Thank you. Another question came in and asked about how does this framework include children in examining safety issues? And that's an interesting one, because I think you did cite an example or two about Safe Routes to School and some youth-focused safety issues. If you could elaborate on that a little more. That's
a really good point. I did pick 2 kind of kid-focused case studies. Yes. So I think that again, these can be used for kind of any persistent or challenging problem that you are really trying to kind of structurally determine and get kind of underneath of, right? And so what they're really supposed to do, and why I think they're great for a safe system approach, is, right, traditionally, I think a lot in transportation safety, we focus so much on proximal risk factors. And this is really focused on saying, well, what's underneath that, right? What are the structures driving? Like, let's go further upstream and understand how we can kind of more effectively intervene on the actual structures. And that could be really understanding, like I showed, child and youth pedestrian injuries. It could be better understanding impaired driving. It could be sort of any number of kind of persistent transportation challenges. So yes, definitely can help with child passenger safety or child transportation safety issues, but it can help with others. And send me a note if you want to explore more, if I didn't fully answer that question, whoever asked it.
Yeah, it kind of seems like the framework itself, or the approach, lends itself to, you can select the kinds of prompts you want to dive into, and it really is, you can choose your own sort of pathway from there.
Your focus, yeah.
Well, thank you for that. I see that we're just at the end of our half hour. I expect that maybe others of you have questions, or you'd be interested in getting in touch with Dr. Naumann. So we'll be providing some contact information out when we share the slides. But I just wanted to give a big thanks again to Dr. Becky Naumann for sharing her work and this research. And thanks to all of you for joining us today. We will be back with another webinar. So just stay plugged in and we'll share details about that when it's ready. So we'll see you next time, everyone. Thank you.